Stella O'Malley is a Dublin-based psychotherapist, best-selling author, and public speaker. She has written 3 best-selling books, Cotton Wool Kids, Bully-Proof Kids, and Fragile. In 2018, she was the writer and presenter of the UK Channel 4 documentary, Trans Kids, It's Time to Talk. And she currently co-hosts the podcast, Gender, A Wider Lens, with the therapist Sasha Ayad. Stella holds a BA in Counselling and Psychotherapy, an MA in Cognitive Behavioural Therapy, and is currently studying for a PhD about gender-related distress in childhood. Stella will speak to us via video link.
I'm delighted to be here. I spoke already in front of the Parliamentary Committee in New Zealand about the conversion therapy ban, and it feels like there's an extraordinary wave sweeping through the world where there's 2 factions, two different sides of a debate. Both sides think they're very much in the right, and in the middle of all that there's an awful lot of distressed children, and there's an awful lot of very distressed families and parents. And I suppose more than anything, because I'm a psychotherapist, because I had my own issues as a child, that's who I'm most concerned with. As was said, I kind of became involved in gender issues really through the film I did in 2018. And as a result, I'm in a lot of organizations around gender. And, a few years ago when I first got involved in 2018, there were no organizations. There was no GenSpec, there was no SEGM, Cata, Thoughtful Therapist, the GDSN is for families, the ICGDR, the Institute for Comprehensive Gender Dysphoria Research, that wasn't there. That's Lisa Lippman. These organizations weren't there because everybody was kind of trying to figure out what was going on. And now it feels like the tide is turning and people have figured out what's going on. And what's going on is very much an ideological belief has taken over many different kind of elements of society. And it's a belief. And I'm all for beliefs. I'm all for theories. But there's lots of beliefs. And so long as everybody can discuss their beliefs and everybody can figure out what is the best way to treat something, so long as we have conversation. So I'm hoping that anybody who's listening to me who doesn't agree with me, I hope they ask questions. We'll have a Q&A at the end. And I hope they ask very vigorous questions, and I'd be delighted to answer them, because I think that's the best way we can handle any sort of mental health issues, or even not mental health issues, societal conflict. So long as we can talk about it, discuss it, wonder about it, analyze it, and there's kind of good faith, then we will come to better conclusions. And I think that's the most important thing that we should kind of keep central in any sort of conflict that we might have between us. As was mentioned, I've written a few books, and I did do this film, Trans Kids, It's Time to Talk, in 2018. And the reason I did it was because of this. When I was a kid, I'm in all of these photos, by the way. I don't know if you can recognize. I'll let you all guess before I tell you which one I am. But when I was a kid in 1980 Dublin, I had very extreme gender issues. And I was sure I should be a boy. From the age of about 3, I was pretty much I don't remember it. All I know is factually from my family and from my own memory, I was presenting as a boy. I kind of thought I should be a boy. I'd be better as a boy. I suit being a boy. And to this day, I think there's something in that. I think I get it. It makes sense to who I am. So yeah, there is something boyish about me. And just in case you're wondering, I'm the kid in the white T-shirt here with the blue and red stripes. So that's my big sister in the green dress. That's me in the white T-shirt with the jeans in the middle picture. And that's my little brother, and that's my other brother. And, you can see me and my brother, we were like 2 peas in a pod. And that's me in a horse with red shorts and a white T-shirt. And that's me in dressed as a scarecrow in denim in the black and white picture. And so again and again and again, I was presenting as a boy, and I liked it. And, I now know, because I've really studied and become very informed on the subject, I now know I had what was called classic typical childhood onset gender dysphoria. And that is, it arrives at about 3, 4, 5, 6, around about that age, no later than 6 really. And the whole town knows about it. Everybody knows when you've got childhood onset gender dysphoria because the kid tells everybody. And generally, I didn't actually grow up to be gay or lesbian, but or bisexual, but most do. 70% of kids like me would grow up to be gay, lesbian, or bisexual. And it seems to be part of the gay, lesbian, bisexual experiences to be gender nonconforming. Well, I certainly was very, and it lasted many years. So, for example, when I was a kid, there was a school uniform in my school, and the girls wore a pinafore, a tartan pinafore, and the boys wore grey trousers, and we both wore green jumpers. So I went I was like non-binary because I went between the two, because I wore a green jumper, but I didn't wear the grey trousers of the boys. I just wore jeans. And I never wore that pinafore for school. So the school looked away and let me be, because it was a different time. And back then you didn't get sent into clinics. You didn't get sent to psychiatrists. You didn't get evaluated. I was just an eccentric, strange kid, and everybody knew it. I was haunted by the question, are you a girl or a boy? I generally answered, I'm a boy, but sometimes I just said no in some sort of non-binary rejection of the thing. But I knew I was really serious, and it was all fine from about 3, 4, 5, 6, 7, 8. That was fine. It was easy. I knew I could intimidate people about my force and confidence of how boyish I was. Then puberty hit and I spiraled, and it was really difficult. I was really unhappy. I lost myself completely. And they were very, very, very hard years, puberty were. I knew I'd boxed myself into a corner, painted myself into a corner, and I didn't know how to get out. I realized nature was bigger than me. I realized that I had told the world that I was a boy, and it's blindingly obvious I wasn't. There was a reckoning. And I realized I can convince everybody, but they'll still not be convinced. And my force of personality can be as forceful as it wants, and I still can't change the wind. I can't change the world. So it was me confronting reality. And so the fantasy, which I was frankly entitled to have, because children are very well versed in magical thinking, and developmentally, it's perfectly appropriate till around about age 8 or so to have magical thinking. We do it all the time. We allow children to think they're Superman. We allow children to think lots of things, and we let it go. We don't massively encourage it, but we don't burst their bubbles. You know what I mean? So we gently bring it around, but we don't hit them over the head with it, generally. And then there comes a time somewhere around pubescence where we think, yeah, no, reality, key in there because it matters. And it's part of the tasks of adolescence. It's part of the reckoning between puberty and adulthood. You have to confront reality. You have to accept the facts of your life. And I hit a brick wall of reality when I hit puberty and realized I can tell the world I'm a boy. I can go into the boys, sports clubs and stuff like that. I can be the best fighter and the best, footballer, and I'm still not a boy. And that brick wall of reality was very hard, and I didn't want it. I didn't want to be a girl. I hated girls. I had a massive streak of internalized misogyny. I looking back, I thought girls were awful. And not only that, I looked down on tomboys. I used to roll my eyes at George and the Famous Five, like, oh, what a girly tomboy she was. I thought tomboys were absolutely blithering idiots because I was the real deal. So I was very obstreperous in confidence in this. Eventually, when I got through puberty, eventually I came around to who I am, became comfortable in my own skin, went on to marry and have children. And I'm very glad I didn't transition. Had I been introduced to the concept of puberty blockers, of trans, of you could be somebody different, you can convince the world. They are transphobic. They are wrong if they try to hit you with reality. Your fantasy matters more than reality. I would have sang to that. I would have been delighted to be able to kind of use my force of personality to insist that everybody comes around to my thinking rather than I come around to reality. It would have been a very dangerous and very, very inappropriate way for me to live. And now I know about the realities of puberty blockers and the realities of various elements of medical transition. I can say it's a very heavy medical burden on the body. So it's not something that should be done easily. So what I would have been diagnosed with had I been brought to doctors, had we been the type of family that was going anywhere near doctors from something like that, would have been gender dysphoria diagnosis. Back then, pre-2000, it used to be called gender identity dysphoria. And what it is, it's called the psychological distress that results from an incongruence between your sex and between your gender identity. Basically, you feel like you should be not a girl or, not a boy or whatever. And it's a clinical diagnosis. And so when people say trans is gender dysphoria, it's not quite. Trans is whoever wants to be trans. Trans is it's an umbrella term that anybody, today, right now, I could declare as trans and nobody can refute it, because trans is a self-identified term and it's an umbrella term for anybody. While gender dysphoria is an actual clinical diagnosis that has actual criteria. And so it's very, as was mentioned earlier, like the misinformation around this whole debate is astonishing, and it's a dense subject. And I know I'm on the screen, so it'll be hard for people to be as interested as if I was in front of you. But it's worth really learning all the different words, all the different facts, because while it is a very dense subject, it's also a very compelling subject, because it gets to the very root of what it is to be a woman, what it is to be a man, what is shaping us, who are we, what makes our sexual orientation develop. It really does have an awful lot of very compelling questions. And if only we lived in a world where those compelling questions could be analysed in a free society without being risk of being accused of terrible, terrible thought crimes. So one of the interesting things is sexual orientation is not gender identity. And one of the major issues, for example, with the conversion therapy bill, let's say in New Zealand, is they conflate gender identity and sexual orientation as if they're the same thing. They're very, very different experiences. So the sexual orientation is what you think about other people who you fancy. Gender identity is something within you. It's an unfalsifiable, unprovable, subjective sense of something within you. It's incredibly like the Catholic soul. I'm an Irish Catholic, and I'm not anymore, but I've certainly raised an Irish Catholic. And when my mother tells me I have a soul and you have a soul, I'm like, I can't prove it. I can't falsify it. I don't think I have one, but she tells me she has one and I have one. And what can I do? It's very similar to a gender identity. If somebody says they have it, they have it. Sexual orientation is actually tested. You could put kind of, what are they called? Gadgets on me, and you could test who I fancy through my adrenaline, my sweat, my blood, my pulsation, my genitals, the whole thing. It's a testable thing. Not only that, sexual orientation, as it says there, there's participation required when somebody comes out as gender dysphoric or trans. They require you to change your way of speaking about them and of thinking about them. Well, being gay, if a 6-year-old today declared that they were gay, you would think, very young. I don't have to do anything. I don't have to comment. Don't have to develop this conversation. We'll let this unfold. And somebody today, that 6-year-old said, I am trans. There can be very quickly, the child themselves or other adults can say, you now have to call them by a different pronoun. You now have to give them a different name if they so wish, bring them to different sports teams, go to different toilets, different changing rooms. So there's a lot of participation required when somebody declares a gender identity. And they can declare it according to the experts on the gender affirmation model in WPATH, the World Professional Association for Transgender Healthcare. They say as young as 2. And Diane Ehrensaft, the great advocate for WPATH and affirmation, says as a child as young as 18 months can communicate a gendered communication. So there is no age under limit, if you follow me, minimum. There's no age under minimum. Medical transition is not the same as coming out as trans. It's a very, very different process. Being gay doesn't require active participation from family, friends, or society. It doesn't carry a heavy medical burden, and it's testable and evident in the animal kingdom. So if you learn anything today, learn that these are 2 very, very different experiences, and they should never be conflated, because you're looking at 2 different cohorts. Generally, people with gender identity have an awful lot of other mental health issues. People with sexual orientation don't. This is an incredibly different cohort, and they have different needs, and they have different traits in the population. And so we need to be very aware of it. Now I'm giving you a bit of, it's going to turn into a little bit of class for a few slides, and then it'll get more interesting, but bear with me because I think it's worth knowing things like this. So there's lots of theories related to how does somebody like me, for example, become gender dysphoric. Some people say it's gender identity theory. There's a theory, there's an identity, it's within me. And if it doesn't match my outer self, I need to just medically transition as much as I want. Somebody who's gender critical could say, no, it was the imposition of roles. And I actually do think as a child, I didn't like the girliness of girls. I didn't like pink. I didn't like the prissy. I remember fancy paper was just anathema to me. And I like the toughness of boys. So that would be very falling in with gender critical theory, that I developed my dysphoria because I was like, that is all not me. I personally hold with the third theory here, which is the developmental model. And I have a developmental model of depression. I understand most anorexia, most different mental health issues. I would have a developmental, that it's kind of part of our development because of maybe the roles that were placed upon me, maybe other things that actually ultimately I end up with some distress. There's also trauma. Some people develop it because of trauma. They might hate being a girl or a boy, for example, after sexual abuse. That can sometimes happen. And the biopsychosocial model, which is, it could be a little bit of biology, it could be a little bit of psychology, it could be a bit of society. And that's, people say, oh, there might have been an influx of hormones when you were a fetus. And they've never yet proved this, but I am open to being disproved that it's not a developmental, that it might be something else. I'd be delighted to have more discussion about it. Sadly, we're living in a world where discussion has become very shut down. I have to commend the conference organizers for, having the courage to hold an event when it's very unpopular and scary and frightening, and to just hold their own and just say, yeah, we need to get information out. And we do. And I hope that people after the conference today feel a little bit encouraged, as in more courageous, and start speaking out if they have an issue, that they speak out. So here's a few options that people could treat gender dysphoria. Like I say, I'll get into the deal around the family quite soon, but I just wanted to give a bit of background first. And don't forget, there will be Q&A later on, and I'd be delighted to answer questions. So just write down any questions you might have. So here's 3 basic ways you can deal with gender dysphoria. For starters, you could help the person become accepting of their body, which is ultimately what happened to me. So obviously, because of my own experience, I'm going to favor that. But effectively, the idea would be that you come around to your flawed body and all the limitations of life, and you end up saying, yeah, it's okay. I have this body. I live with it. I would have rathered being a boy or whatever, but I'm fine the way I am. I'm personally delighted I'm a woman. I don't think I really appreciated being a woman until I had kids. And I think having kids was the most phenomenal thing I ever did. And it's my little boy's birthday actually tomorrow. And and I think it's tomorrow over there in New Zealand. So it's technically my little boy's birthday over there today now. But I think it was phenomenal. So I didn't really come to an appreciation of being a woman until I was in my 30s, because that's when I had kids. So the second treatment option would be medical transition, that you change your body to align with what's going on in your head. So you can change your mind to align what's going on with your body, or you can change your body to align what's going on in your mind. I would argue that the least invasive would be to change your mind, because to change your body carries a very heavy medical burden. That heavy medical burden is infertility, it is impaired sexual functioning, difficulty to orgasm, cardiac problems, osteoporosis, all sorts of other kind of issues that are only coming out now, like vision problems with puberty blockers and cognitive impairment. Serious, heavy medical burden comes with medical transition. It's a hard life. And that's where I would say nothing to do with transphobia and everything to do with the medicalization of your body is heavy. The third option everybody can do, which is you can improve your coping skills. And if you improve your coping skills, it's a gift for life. So if you can kind of manage to cope with distress better, manage to cope with your inner conflict better, you will be better for it. So I would always start with coping skills. No matter what you are, no matter where you are, you can always increase your coping skills, if at all possible. And so that would be the third option. And then you could decide whether you want to change your body or change your mind. To me, this is a nice distillation of these are the choices. These are the choices, what way you're going to go at it. Rather than politicize it, these are the basic 3 choices. Now, when I look at the actual history of psychology and gender dysphoria, you could say there have been 3 major treatment approaches. Watchful waiting was the kind of the traditional approach, where a child would come. They knew that about 80% of children, well, the actual stats is 61 to 98% of children grow out of it. So I'm in that number, 61 to 80% of kids, 61 to 98% of kids who grow out of it. And I grew out of it. And I didn't get any psychology, didn't get any counseling, I didn't get anything. I grew out of it on my own. And I am typical. Now, these days, if you ask your child, if you try to do watchful waiting when you are, let's say, a distressed parent, and you've got a child who has gender distress, and you're thinking, I'm going to try and do the watchful waiting. I'm not going to bring them to a doctor. I'm just going to do this watchful waiting, which is you're just waiting watchfully, and you're just keeping an eye on it and hoping that they'll come around to their own space, one way or the other. The issue with that, and I do a podcast called Gender: A Wider Lens with Sasha Ayad, and she's a therapist too. And the issue with that is, what are they doing these days when they are waiting? Because these days they might be online all the time, and they might be building their identity like a carefully nurtured bonsai tree. They might be absolutely creating an identity. And that's not watchful waiting. That's actually, intent on transition. So I'm not sure if watchful waiting can really be carried out in this world where trans is just so big online, especially if the kid is online a lot. The gender affirmative model encourages the child to live in the gender that feels most comfortable right now, with or without medical intervention. That can be, as I said, as young as the age of 2. At 4 or 5, they might change their name, they might change their pronoun, they might go to different toilets. At about 10, they'll go to puberty blockers, then they might go to cross-sex hormones at maybe 16, 17, 18, and then genital surgery. So it's a very aggressive, very interventionist, very medicalized approach. And the treatment option I favor would be gender exploratory therapy, where you're bringing about self-awareness. You're bringing about self-awareness of what's included in gender transition, what is included in medical intervention, and also how have gender roles impacted them? Have they internalized misogyny? Have they internalized homophobia? There's a lot of different ways to go at it. So as I mentioned just there, the gender affirmative model, basically the therapist is just a facilitator, and they facilitate change of name, social transition, change of name, change of pronoun, toilets, sports, puberty blockers at around puberty, stops puberty, stops all sexual development, stops the growth of your genitals, stops the growth of breasts, stops the growth of, the development of any sort of sexual feelings to the opposite sex. So if you're among your teenagers, you won't fancy anybody. So if you happen to be a non-conforming gay, lesbian, or bisexual person, you won't fancy anybody because your sexual development has been blocked, just like very much a sledgehammer to crack a nut. Then cross-sex hormones, maybe from the age of 16 or 17, which means you go to become the opposite sex, or certainly try to, and surgeries, double mastectomies, genital surgery, very heavy, very, very heavy treatment. There has been a recent closure of the Tavistock, which is the largest gender identity clinic for children in the world. And it has been operating for the last, let me think about this, 30, 35 years. And it uses the gender affirmative care model. And an independent review carried out a full and forensic review of it. It's called the Cata review. And they deemed it just last Thursday, not a safe or viable option. They said not a safe or viable option for children in the long term. So this gender affirmative care model has been reviewed in Sweden, which was the gold standard of pediatric transition since 1972. And they've pulled back from the gender affirmative care model, and they no longer use it. Out of 5 out of 6 clinics in Sweden, they don't use it, and 1 clinic only under strict clinical trials. Finland have pulled away from the gender affirmative model, and now they favour psychotherapy instead of heavy medical intervention. France have pulled away from the gender affirmative model, and the UK are now closing the Tavistock. Why they're closing it next spring and not today, because they've basically said it's unsafe. And it occurs to me, I'm like, okay, if you had a clinic and they were treating other conditions, like serious conditions like diabetes, and they said it's not safe, I think they could close it today. So I don't know what's actually going to happen between now and next spring, but it seems to me that it's an inappropriate way to close a clinic But I'm very, very thankful that the Cats Review has studied it and come out with this. So if your child is receiving gender affirmative care, you need to kind of study what's going on in these other countries and realize there are other options. There's an awful lot of parents who are clashing with clinicians. And I discovered this after I did the film in 2018. And the premise of the film I did in 2018, it's called Trans Kids, It's Time to Talk, was, could it be that any of the 4,000% rise in girls who are seeking medical transition, could any of them be like me? Because I grew out of it. And I was told I was transphobic for doing that, for even thinking that, let alone asking that. And afterwards, I thought, this is very strange. And I was inundated with emails from detransitioners, from people who were lost in transition and unhappy, from parents who were devastated about the care that their children were receiving. And over time, I started running groups, parent support groups, which is the Gender Dysphoria Support Network, which is listed there as one of the international groups. And I quickly realized, oh my God, there's a huge underground network of parents groups all over the world. Look at all the countries listed there. They're all parents groups who are very unhappy with the gender affirmative care model that their children are receiving. And these parents are devastated. They're generally very well educated, and they're very, very loving and engaged parents. And they believe their children are getting the wrong care. I remember one parent saying, I was in the doctor's clinic and I thought, my child who has autism, who has serious mental health difficulties since he's been a young child, I thought we'd get to the expert, we'd get to the gender affirmative clinician, and the expert would explain to my child that they think that transition is going to cure everything, but it's not going to. And then when they got to the office of the clinician said, we'll put you on puberty blockers in your next appointment. And she felt like she was in a horror film, and that the good doctor who's going to save her child just had ripped off his mask, and he was actually the villain. It was a really frightening moment in her life. And I remember her describing it to me, and it was so chilling, this feeling of the doctors aren't looking out for our children. The doctors are just putting our children on a fast track of medical intervention without much thought about any other option. Perhaps maybe address the autism, perhaps address the trauma that the child has resulted in. So as I said earlier, there is diagnosis. You have to have one of any of these 6 criteria. I had all 8. But by the way, of those 8 criteria, 5, 1, 2, 3, 4, and 5, if you look at them, they're all about stereotypes. It's things like wearing clothes of the opposite sex, playing games of the opposite sex, playing toys of the opposite sex, playmates of the opposite sex. This is stereotypes. It's like something out of the 1950s, and it's unbelievable. It's still in the DSM as frankly a massive level of stereotypes. If you like, pink, that you're not really a real boy, it feels very regressive. So it's just something to be aware of. Anyway, you only need 6 of these criteria for 6 months. I had all 8, and I had it for many, many years. So, and I still grew out of it. I do think that there's a certain number of children who aren't happy with the confining kind of nature of childhood these days, where boys are supposed to be a hero and boys are supposed to be blue, girls are supposed to be pink and pretty and cute and princess and fairies. And about 90% of kids don't care, and they roll with it. I'm wearing blue, I'm wearing pink, who cares? Mommy's happy. And there's a certain small percentage who just hate it. And those kids, it doesn't sit well with. Then there is the new cohort, which is what most of you are here for. And I'd say you're looking at me thinking, why should I talk about childhood? I'm talking about childhood because you can see the difference. They were always there. Those children were always there, and they always will be there. There's a new cohort, and they were never seen before in the medical literature. There was always 2 groups, children and middle-aged males. We're not going to talk about middle-aged males because it's all about children and families today, and I could do a whole conference on the males, the middle-aged males. But the adolescents were never known in the medical literature. They never appeared. So they're lumped in there with the diagnosis for adults, but they never appeared. And you need just two of these criteria, which is basically you want to be the opposite sex. And if you have that for 6 months, then you've gender dysphoria. It's a low bar. But like I say, never before have adolescents been seen. And suddenly, Around about 2012, it started shooting up. Interestingly, that's when smartphones became more common than dumb phones. That's when social media took off. That's when teenagers at a very fast rate started meeting each other on, different spaces online. And that's when the numbers started to rise at a very fast pace. And so there's a 2,000% rise, for example, in the largest gender clinic in the world, JIDS, which is getting closed down next spring. And 5,337% rise in girls. So it's particularly high in girls. Never before in the medical literature were adolescent girls at all interested in it. However, when you look at anorexia, before the 70s, there was no sign of anorexia. It was the odd very unusual case, which was written about by Freud or whatever, but not very often. And then suddenly it came in as a way for teenage girls to manifest distress and to hate their bodies. After anorexia, or as anorexia continued, then bulimia came in. Once it came in, it stayed. Once bulimia came in, it stayed. A new way for adolescent girls to hate their bodies and to reject themselves. And then it stayed. Bulimia stayed as a coping mechanism. Then self-harming came in, another way for adolescent girls to hate their bodies. And now gender dysphoria has come in, yet another way for adolescent girls to reject their sexually developing body. It feels to me like something extraordinary has happened, along with the celebration of the teenager since around about 60s or 70s, and teenage girls' bodies, has come an extraordinary response from teenage girls, which is, I hate my body. And I'm very interested in sociology and who are going to be the sociologists who understand that something extraordinarily bad is happening for adolescent girls. Now, I shouldn't just say it because the boys are coming hard and fast behind the girls, but it's really noticeable that it started. The girls are the cuckoo in the coal mine, canary in the coal mine, not the cuckoo in the coal mine. But yeah, so as it says, what are the two differences? In childhood aged 3 to 6, it arrives. It's very, very, very clear and direct. The whole town knows about it. Everybody shouts. They know, I'm a boy, they shouted. No intervention is necessary, and often these children are pre-gay. In adolescence, it's quiet, it's secretive. Very often there's comorbidities. Nobody knows about it. Very often there's a lot of secret online technology, and it has never been seen before in the literature. It didn't exist. We didn't see it. There was the odd unusual case, but it really wasn't seen. And so with this sudden change in the cohort, people like myself have said, what's going on here? Why was it never seen before among adolescents? Why was it only seen in young children and middle-aged males? And why suddenly are adolescent females interested? And what about the fact that these adolescents, as the quote there says from the Lisa Littman study, or from the Hilary Cass study, actually, sorry, my mistake, this mix of children are more complex than ever seen before. So the children in previous times, the children were like me, they just wanted to be the opposite sex. These adolescents generally have other issues such as ADHD, ASD, OCD, obsessive compulsive disorder, anxiety, eating disorders, trauma, PTSD. This is a very, very, very vulnerable cohort. And in 2018, on August the 16th, Dr. Lisa Littman released her paper, and she called it a new manifestation of gender dysphoria, and she called it rapid onset gender dysphoria. It's not a diagnosis. She wasn't saying it was a diagnosis. She was saying there's something going on and this extraordinary rise, and what the hell is happening. And we, by the way, I work for GenSpect, and GenSpect have designated August the 16th as ROGD Awareness Day. And if you're interested in social media or Twitter, please keep an eye out on and help us with the hashtag ROGD Awareness Day on August the 16th, because it's up in a few weeks. And just to bring awareness to this concept, because it's ripping apart families, it's ripping apart teenage girls especially, but also teenage boys' minds, because they're incredibly, incredibly distressed. It's not, as it says there, it's not a diagnosis, but it is a phenomenon, and it is really making its presence felt. And it's a new phenomenon that parents don't know what to do about. And as it says, look how vulnerable this group are. 43% had been isolated from their peers. 45% were engaging in self-harm prior to ROGD. 48% had experienced a traumatic or stressful event prior to coming out with ROGD. 63% had other diagnoses, such as ASD, OCD, one of those, and 69% had social anxiety. These are incredibly vulnerable. The most vulnerable group of teenage girls are the ones who are susceptible to ROGD. In case anybody can hear in the background, mad coincidence, there's fireworks outside. And I didn't know, I had no idea that this was going to happen. But anyway, just in case you think there's bombs outside, that's what it is. So, yeah, there is comorbidities among gender dysphoric adolescents. These are them. I've named them already, the OCD, the autism. It's not an encapsulated condition. And it generally, if your child has come out with gender issues, I would strongly recommend evaluation for other issues such as OCD, ASD, eating disorder, very big with eating disorders. And I think it's understated. And there's a lot of traits. You kind of start recognizing their traits. Don't forget, I'll take questions later on because I know this is very dense, and I hope I'm not going too fast. I know I go fast, and I hope it's interesting. In a way, if you want the slides, you can contact me later. That I'm easily found on social media and stuff. But the point is, I'm trying to make it interesting, but also informative. And this is dense. It's a dense subject. But yeah, they're really noticeable for their traits. They're the quirky, intelligent, naive, a bit gullible, full of certainty. They've online diagnosis and they know everything. They're often very privileged. They've definitely been influenced online, and they're often very obedient until the day they say, I am trans. They've basically said yes to everything in life very often. Now, there's another cohort, there's another type who are sometimes the opposite of compliant and obedient. And we spoke about that in our podcast recently. So they're not always obedient, but a lot of them are. A lot of them are naive, gullible, quirky, intelligent, very sweet-natured kids. They are the group that I see again and again and again. And when I discovered those secret networks of parents group all over the world, they were all describing the same kid. I couldn't get over, nor could the parents. When we all came together in all these groups, I realized this is a phenomenon. And as a result of all of those parents groups, we formed GenSpect. And the idea of GenSpect is to bring a rational approach to gender, because it's like everybody's gone mad. So the common sequence of events that happens, usually following a traumatic event, they've usually spent a lot of time online, very into anime, DeviantArt, Tumblr. The young person generally identifies, first of all, as gay, bisexual, lesbian. Then they identify, YP is young person. Then they identify as trans. They've self-diagnosed over the internet. They know somebody that's come out as trans, either online or in real life. And for parents, they just think this is just another issue on a long line of issues. For the child, they think, I have the solution to my life. I feel uncomfortable. I don't like my body. I feel ill at ease, maybe because of their autism, maybe because of their ADHD. I don't feel like I'm part of things. And now I have a solution. And there's nothing more alluring in life than thinking, I could be somebody different. I hate my body. I don't want to be me, and I could be somebody different, and nobody will be allowed to refer to the old me. That old, awkward, humiliated, horrible me will no longer exist, and I'm going to be somebody different. And I'm going to be like that person on YouTube, who I might even have my own YouTube channel, and I'm going to be really popular. And actually, I'm going to be part of the edgy group, and I'm going to be the part of the cool group, and I'm going to be special. There's nothing more alluring in life for a quirky, awkward, unhappy, isolated, self-loathing teenager to think that they could be somebody different. And there's a great book by Jon Kabat-Zinn, the grandfather of mindfulness, and the title of the book is Wherever You Go, There You Are. And that's the tragedy, and that's the reality of life. That's the reckoning. So when reality meets fantasy, the teenager thinks, I can be somebody different. And the parent is thinking, you can't. We don't have an option to be somebody different. We can only be ourselves. We have to. I'm stuck with who I am. Would I like to be less impatient, less cross, less narky, less passionate, less lots of things? Yes, reduce it all if I had an option. But I don't have an option. I'm stuck with me, and you're stuck with you. And you just have to, in a way, work with what you've got. And yes, you can change your body. Of course you can change. Of course you can transition. But you're still going to be you. And these teenagers often think they're going to be somebody different. And that's the difference between reality and fantasy. These are naive kids. They're often very immature and they haven't quite hit the reality wall that they need to hit during adolescence. It's the job. They generally announce it in a very dramatic way at Christmas dinner and Christmas card, on their birthday, at the last day of school, at the first day of school. Very heightened emotion. They think they have the solution to life, so they declare it with huge, huge emotion. A lot of crying, and they've generally copied and pasted it from the internet. They've seen somebody else do it, filled with huge emotion and certainty. And the parents are wide-eyed going, what is this all about? I don't know anything about this. And it turns out my child is some sort of genius about this, because the child has been nurturing it maybe for a year, maybe for 2. The child has been looking online, at first in a little way and then intensely and constantly for maybe thousands of hours before they've announced it. And so the teen is way ahead of the parents. And the parents are like, what is going on? I'm literally clueless. And they have to learn very, very fast. I find the parents that I meet, they have PhD levels of information. They know so many studies, they know so much, but they have spent hours upon hours upon hours studying it because their children have got completely enraptured upon it. So both child and parent are just obsessively studying it, and they're seeing different studies. Why? Because of the echo chamber, because of online algorithms. So what both need to do is stop being on the computer and meet each other. And that's very hard because everybody's obsessed with what's on the computer. Some very common responses is isolation, miscommunication in the family, division. The siblings can be very unhappy about which way to go. Do I go with the parents? Do I go with the sibling? A lot of secrecy. A lot of secrecy happens. A lot of secrecy happening in schools, revised history. So the child who's filled with self-loathing says, I was always like that. I was always trans. The parent is going, that's not true. I was there. I remember what they were like. And they're like, no, you got it wrong. Often a huge amount of social contagion that's spreading throughout the population, generally often because of excessive empathy, co-rumination. Everybody's repeating it. There's a lot of positive reinforcement of, being trans. Everybody's reassuring each other. It's a very febrile atmosphere, very often in school. And it feels like it spreads, and it spreads quickly. And, it's true. If you know somebody, if a teenager knows somebody who's trans, they're 70 times more likely, this is in the Lisa Lippman study in 2018, 70 times more likely to come out as trans themselves compared to the general population. So knowing somebody who's trans is a huge risk factor, or if there's another phrase, a kind of huge indication that there might be more trans on the way. So it's definitely something that goes through populations, and anybody who works in a school will have seen it in recent years. So the difference is parents are looking for an understanding of what's going on for the child. The teenager is looking for an identity. And that is developmentally appropriate for a teenager. That's what teenagers should be looking for. Parents are thinking, what's going on? The teenager is like, this is who I am. And it's like a shield. This is who I am. I've wanted to know who I was. Just like the other kids might have had an identity in other things in other decades. The teenager might be repressing their sexuality. They might be very uncomfortable with their sexuality. And so they submerge their gender identity within the sexuality. Some of them are really, really into creating an online persona. So they've really got into it, and it's their escapism. I can forget about life. I can just go and be that persona online. Both of them are seeking a therapist. The teenager is looking to confirm that they're trans, that they have this trans identity within them. The parent is looking for understanding. I'm not sure that therapy should be the first port of call. I think leaning in with love and boundaries is probably a more effective way rather than getting the professionals in. I think we've over-professionalized parenting. And I say this as somebody who's written books on parenting. And I have a book on teenagers on the way. I'm just finishing it at the moment. But I do think we have. And so I'm kind of contradicting myself. And I try to be light touch in whenever I discuss it. I really do think that parents are the world expert of their children. And parents need to hold their power in this frightening time. Some children actually think that they can change sex. So I remember this girl And I knew the parent and I knew the teenager. And I was explaining to the teenager and the parent the impact of testosterone and how it has it courses through the female body. It's very harsh on the body, gives a lot of vaginal infections, gives, an awful lot of pain really on orgasm. And the teenage girl said, oh, no. That wouldn't happen to me because, you see, I'm male. So that wouldn't impact me. She had an autistic understanding of, if you change your pronouns, you are now male, so you have a male body, so testosterone will be good for you. And I was saying, no. You have a female body that will never change, but you're inserting testosterone into it, as some people say, putting diesel in the petrol tank. It's not that you're actually changing. You might find that hard to believe, but that's often the kind of literal understanding of the autistic mind. So parents might need to inform themselves about the reality of medical transition so that they can tell their child. And the child will often resist it because they just think it's going to be easy, because the affirmative care model, which has now been discredited, has let them believe it's easy. They think they have the solution to all their problems, and they're angry at anybody who says they're not the solutions. They don't want to hear that. It can be very painful reality, and parents should be aware that they need to be empathetic and patient, that there's going to be an awful lot of relapse, an awful lot of defenses from the parents. And it is really hard on the parents. They're trying to be empathetic and compassionate and patient, respectful of the adolescent's defenses, respectful of the adolescent's identity, sensitive to the risk of social. This is a huge amount to ask of parents. And as a result, as a result, parents can feel utterly exhausted and isolated. And I do recommend you find your tribe. You go onto the GenSpect Discord. If you email GenSpect, you'd very quickly be able to find other parents groups. There's a group in New Zealand you could be introduced to. There is a lot of ways to get support, and I fully recommend that you do. We always recommend, myself and Sasha in our podcast, heavy on love and heavy on boundaries. So you bring in some parental controls around the tech. You maybe say the only can you use your device in family rooms, because they're spending hours creating a false identity, a false persona. That's not necessarily a trans persona. I'm just saying a false persona that they're creating online, that they'd be better off dealing with reality rather than the fantasy life that they should be growing out of in adolescence. That's when they should be moving from make-believe childhood and Santy and fairies over to the reality. And that's what they say, the adolescence is there to break the spell of childhood. We're supposed to be breaking the spell of childhood. It can be very hard, adolescence, but as a result, the reward of going through adolescence is adulthood, freedom to live life as you wish. And that is the rite of passage you have to get through. You have to leave behind fantasy. You have to leave behind magical thinking and come to a place of reality. And a lot of children are really resisting that these days. Maybe because they've had such glorious childhoods. Maybe because they've had a Disney childhood. And they just can't bear the reality that hits them at the teenage years. There can be an awful lot of divided loyalties and an awful lot of alienation and an awful lot of inappropriate accusations of transphobia. And so the parents are talking about RGD and the teenagers are talking about trans. And generally the parents are very liberal, progressive, educated, successful families, very similar to the children of other, certain issues such as, let's say, eating disorders and anorexia. Parents don't tend to separate gender identity issues from other aspects of the teenager's life. For example, an eating disorder or anxiety. And parents are seeking a holistic approach that includes a comprehensive exploration of how are the kind of the different comorbidities. Sorry, I'm going to sneeze now. Excuse me, don't know where that came from, but how the different comorbidities might be impacting. And so parents have to hold their own. They need to find support. They need to try and build in some sort of support among families. And that can be very, very difficult. We do have some brief guidances that you can download from GenSpect, where we have a brief guidance on talking to family and friends. We have a brief guidance on talking to schools. We have a brief guidance specifically just for parents. You need to find your support because it's really exhausting and really difficult. School might need to be contacted to let them know that the child is vulnerable. You mightn't say in what way, but that they're vulnerable. You might need regular input and get to know the school. There's a lovely phrase, become a polite nuisance. You know, you come back and you go back and you go back so that they know you are all over this and that there's no right for anybody to make decisions on your child's health because you're all over it. You need to be very authentic. You need to kind of be able to own the narrative, be able to look people in the eye and have effectively 3 sentences that describe, you know, my teenager is having a huge amount of difficulties at the moment. They have a lot of diagnoses. They're, you know, autistic, and they also have anxiety, and they have some gender issues as well. And we're taking a very holistic view of the child in the long term. And so we're really trying to work through this with all the compassion and empathy that we can muster, so that you are communicating to families and friends and schools and everybody else, I'm on this. I'm the world expert of my teenager, and you might have opinions, but I know a good deal more than you because I love my child more than life itself. And you will never be able to be as engaged as I am with this, because some adults, well-meaning adults, often think that they can jump in on this. They think it's the same as being trans, as being gay. They think trans is gay. I've got this. I'm gay. I'm going to kind of find this teenager and save them. And it's misinformed view. It's well-meaning, and it can really cause a lot of distress. And that's where the parents need to find their authority, and it can be very, very difficult. The siblings can have a very hard time too. They have a lot of divided loyalties. They can be very secretive. A lot of the parents are very unhappy and disappointed with the siblings because they're like, I can't believe they're buying in with this. But I find I do a lot of sibling meetings in the GDSN, the Gender Dysphoria Support Network. And I find the siblings are having a really hard time. They really are. And I'd have a lot of space for the siblings. I'd give a lot of freedom for the siblings to do whatever they want. One thing is, if you are adopting a child, they never recommend you adopt a child older. So if, you know, you have a 4-year-old girl, you don't adopt anybody who's a girl who's older, because it wrecks the birth order and it wrecks their head. So it can be very distressing for you know, a 12-year-old girl to suddenly find out that her big brother is now a girl and is actually the oldest girl in the family. That can be very difficult for everybody, and it can be underestimated how complicated, jealous, resentful people can become. So that's something to be very conscious of. As Albert Ellis says, there's 3 musts in life. He calls it masturbation. I must do well, you must treat me well, and the world must be easy. None of them are true. And the sooner we come around to the acceptance of our limitations, the sooner we can get on with the business of knocking as much happiness as we can out of life, getting a sense of purpose out of life. We parents, we families, we adults need to teach the concept of limitations, that you can live with your limitations and that's okay. And children who've come from a magical thinking onset, and a magical thinking approach, they don't realize that limitations are part of life. We are restricted. I wish I wasn't born into the family I was born into. I wish I wasn't born into the town I was born into. I wish I didn't go to the school I went to. I didn't have options. But ultimately, we can't choose our parents. We can't choose our bodies. We can't choose how we were born. But ultimately, we can become the adults we wish to be. If that means medical transition, so be it. So long as it's an adult decision, I'm perfectly okay with that. But and I, you know, fully accept the fact that some people want to medically transition. However, I think it's incredibly important that children aren't led into a misinformed perspective that this is an easy life, and that all they need to do is kind of click their fingers and they'll become trans, because it's actually very difficult. As I said earlier, social transition is an active intervention. It generally correlates with more likely they will persist with trans identification, because it solidifies everything, especially the pronouns, and it can lead to more problem than it resolves. So be careful around social transition. However, I have to admit in Ireland that there's an awful lot of social transition, and there isn't as much medical transition among children, and it seems to work its way through. So I'm not convinced that social transition is such a bad thing. I think it could be a very nice and interesting way to explore your identity. I know other people don't agree, and I welcome conversation and discussion and argument and conflict around that, because that's how we'll come. It's a new concept. I don't believe in social transition for 5-year-olds, because I think they're engaged in magical thinking, and we have to gently keep leading with authority and reality as an adult. But when they're 16 or something and they're just trying on different identities, it does mean that they can be trying on different hats, because that's what you're meant to be doing between the ages of 12 and 25. That's when identity exploration happens. The problem is if they're autistic and they have a very literal understanding of, let's say, being called he, him, and they might think that makes me a boy and testosterone won't hurt me. So we need to be conscious of our language. And like, for example, born in the wrong body, great description of a feeling, but it's not a diagnosis. They used to use this phrase, and now they realize this leads naive children into believing there was another body that they could have chosen. You know, there is no other body. I'm stuck with this body. You're stuck with your body. You can change it as you wish, but your insides will never be the same. I do think, when you look at Jazz Jennings, I do think, you could say, look at the quotes I've taken from the programs of Jazz Jennings. She's the first trans kid in America. 2006, she came out as trans. She was called something different for that newspaper article. In 2018, she said, "I've always known exactly who I am. I was a girl trapped in a body." She was led to believe that. She was a little kid. And then in 2020, she said, "It's really cool to know that just by being myself, I can inspire other people to be their best selves as well. And that's what it's really all about. By being authentic, I can help other people be authentic too." What does that even mean? I'm not sure. Am I authentic now? Was the person I was when I was 6 not authentic? Or are we always evolving and changing? And then sadly, and I thought it was kind of tragic when she said in 2022, she's had genital surgery. She's had she has breasts. She was born a little boy. She's changed her entire outer body to look like a woman. And yet all the interventions, all the surgery, all the cross-sex hormones, the puberty blockers. And she said, after all that, I still feel like I'm not 100% me. I don't know how to describe it. And I would say, yeah, that's the essential distress of being human. Who am I? Who are you? Where are we? Who are we? That is human. That is the kind of the kind of existential human condition. And as a kid, she was led to believe it's easy. You know what I mean? And I always think of the phrase cruel optimism, encouraging a person to remain attached to an unachievable fantasy, despite the evidence that it's impossible. Encouraging a person to seek out something that will inevitably become an obstacle to their flourishing. And our job, myself as a psychotherapist, but also parents, our job is to manage expectations. Yeah, we don't puncture balloons when they're 6, but we don't encourage an elaborate fantasy, because it doesn't end very well. And a lot of people think the suicide is a huge risk. And, a lot of people give out about Jazz Jennings' parents and stuff, but I do think that they honestly thought that the child would die by suicide if they didn't transition the child. And yet there's very little peer evidence of that, about this, peer-reviewed evidence. Jids at the Tavistock show that in 10 years, this is the largest pediatric gender clinic in the world, in 10 years, 4 patients died by suicide out of 15,000 patients. And these 15,000 patients were on the waiting list and they were receiving treatment. So it was both. It wasn't a case of the 15,000 covered everybody. So it's not like that they got medical transition and that's why it's such a low number. My point is 4 out of 15,000, it's a tragedy, but it's no higher than other mental health conditions. So the idea that this is a high risk, high suicidal cohort isn't true. Sweden did a brilliant study, very, very informative, where they looked at the mortality within 10 years of diagnosis of lots of different diagnoses, such as psychosis, personality disorder, substance abuse, gender dysphoria, autism, OCD. And gender dysphoria comes out in and around depression, OCD, autism. And the really high ones are things like psychosis and schizophrenia and personality disorder. That's where suicide really lies. And so there's a lot of myth around it. And I think the myth has led families like Jazz Jennings' family to think that transition was the only option, when actually it's a terrible, terrible sword of Damocles over anybody's head to think there might be suicide. But it remains post-affirmation. It remains post-medical transition. And indeed, after medical transition, you're 19 times more likely to die by suicide. So there's no solution to life. Samuel Beckett said that, the great writer. He said, you're on earth, there's no cure for that. There's no cure for life. We have to we have to deal with reality, and that's very difficult. And there is a distinct slide after medical transition, about 10 years after. So this is a difficult, baffling, cruel condition for somebody to have. And if you're around somebody, your family can be lacerated. They can be really, really in an awful lot of trouble. I do recommend that parents defend the right to make mistakes, that parents realize that we need to be flexible, we need to be robust, we cannot walk on eggshells around our children. It's so important that we don't allow children to rule the household, because it can be really, really distressing. I'm coming up towards the end of the talk. You'll be glad to hear. I'm sure that was an earful for a lot of you. I hope some of you will have some questions in a second. I do think there is an arc of detransition. It's, when I first started following Detrans Reddit, there was less than 1,000 members. And if you look up Detrans Reddit now, there's about 35,000, 36,000. So about 4 years ago, there was less than 1,000, and now there's 35, 36,000. Now, a lot of them are people like me who's just following. About a third of them are detransitioners. It starts with distress and moves into hope. They get a sense of belonging and a feeling of euphoria and expectation they are going to be somebody new. And then when they transition, there's disappointment. They feel lost in transition. They feel regretful, angry, and they come to detransition. It's a hard, hard road. We have a great, on GenSpec's YouTube, we have a great conference called Detrans Awareness Day. It's the 12th of March. And the majority of the detransitioners felt they didn't receive adequate evaluation. And only 24% go back to the clinics. So 76% of detransitioners, the clinics don't know about the detransition. And you can see a few pictures there. These are people who've detransitioned. It's a sad, hard, difficult life. I really recommend that you go and have a look at it on our YouTube. Look at Detrans Awareness Day. You'll hear some harrowing stories, but you'll see some strong, gritty people who've been through hell and come out the other side. That picture is Sinead, who's a great friend of mine, detransition woman, brilliant, really powerful person. She's a GenSpec advisor, and she transitioned and detransitioned and has come out the other side. It's a harrowing, difficult process, but ultimately you can come through it, and there's going to be many people who do come through it. And what we need to do, I think, as adults in the room, we need to realize identity formation is a fundamental aspect of adolescence. Us parents and adults and mental health professionals need to understand that adolescents need to deal with reality. It's fine to have magical thinking as a child. Ultimately, by the time you're an adult, you need to become kind of in touch with the reality of life. And that's very difficult. So I hope you learned a lot from that. I hope it wasn't too much. And I welcome any questions that you might have. I do have resources, and, what are they called? I have references for any of the information that I gave you. So would anybody like to ask a question? I'm not sure how the questions will come in if they do.
Hi, Stella. I'd like to know whether everybody who goes through surgical transition has a condition called body dysmorphia, whether it's the same thing or whether there's a difference between those two actions.
Yeah, it's a very hard question to answer. It's a very good question to ask. One could argue that an awful lot of people who go through surgical transition have body dysmorphia. I happen to know somebody who had their ears pinned back, and he said, it wasn't body dysmorphia. It just was a sensible idea because I got so much slagging about it, and I pinned them back, and I've never given it a thought since. And, honestly, I know him well enough to know that it's true. And so that was an interesting kind of lesson for me, that it's not generally always about body hatred. He just was bored and didn't like been mocked. But then people who become obsessed with their body dysmorphia is like constant checking, constant looking, never not, and always thinking about it, always looking at yourself, always seeing a lot, I would argue, an awful lot of girls who say that they have gender dysphoria have actually body dysmorphia of the breasts. That is a really common, I would argue, misdiagnosis, and they should be diagnosed with body dysmorphia of the breasts. And so it's a really relevant issue. And I think body dysmorphia needs to be brought into the conversation way, 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 way more than it is. And I have another talk, just so you know, that I give to clinicians, and we talk a lot about body dysmorphia.
Stella, hello. Thank you for the informative lecture. I would like to know if there's a connection between addiction and transgenderism. I've been wondering about that, especially with young people, whether addiction and transgenderism, if there's any connection.
Yeah, I think that you could argue it's in its own way, it's an addiction to a concept, if you follow me. They're fixated. So rather than addiction, I don't usually frame it as that, but if I could see why somebody would, and I used to actually frame it as addiction. I don't anymore. Now I seem to mostly frame it as a kind of an obsessive compulsive fixation. So it's very like the obsessive compulsive mindset. And if you look up OCD, the obsessive compulsive disorder, you'll realize that actually which isn't a million miles from addiction, because obsession and a compulsion behavior. So I'm an obsession with an idea, I'm trans. Compulsive behavior might be checking, might be looking in the mirror, might be seeking medication, seeking surgery. So obsessive compulsive, you know what I mean? It's fixation and it's behavior. So it's very understandable that I would come out with that. Addiction in many ways is a form of that. It's you're obsessed and you want the drugs. You know, you're obsessed and you want the alcohol. So, you know I might be kind of psychobabbling here, but I think to me the most easiest way to understand what is going on in the gender fixated young person, very often for me the easiest framework is obsessive compulsive. They're obsessed and they have a compulsive need to behave in a certain way to reduce the obsession, and it doesn't work. And it gives a temporary relief. They check in the mirror, they put on the binder, they give a temporary relief, and then the obsession comes back, and then they have more compulsive behavior. They go online. The behavior is very compulsive online. They create the identity online. They go back to their obsession, and they're never really leaving that dreadful kind of circle that they're going around and around and around. And so I would be very very inclined towards more that sort of framework than the addiction framework, but I'm happy to be disproved, because I think they're not a million miles between the two in my eyes.
An online question from Helen. I feel like myself and my partner almost have PTSD after living with us for 4 years. We carry so much grief. Is this common in the parents you've worked with?
I can't describe how much pain, devastation I've seen among the parents. I'll never forget it. I'll never forget my first meeting with the GDSN on a whim on the first week of COVID. I decided to have a parent support meeting for these gender, parents of gender kids, because so many of them were emailing me. And I went downstairs afterwards, and I was in tears telling my husband about what I just heard. The pain, the isolation, the feeling of the doctors not caring, the feeling of the schools and the institutions and everybody just looking away, the feeling of the world's gone mad, the feeling that your lovely, gentle, quirky, crazy kid has just lost themselves in a fantasy. It is utterly devastating, and I think PTSD is exactly what many, many, many parents are suffering. And it's it's shocking to watch it. I have so much sympathy for the parents. I just think they are in a horrible, horrible, horrible place. And if I could help them in any way, you know, I work so hard, and so much of it is driven because of I just seen so many devastated families. And yeah, PTSD is definitely where I would land with them.
I've got another question. In our media in New Zealand, there's a complete blackout of any gender critical views. And now more and more we're seeing repeated that gender dysphoria is not a mental health issue, even though coupled with that statement will be, but they should get more medical care, you know, it should be easier to get medical care. The New Zealand Psychological Society said in a recent newspaper article that being transgender was not a psychological illness or disorder and was a healthy variation in human functioning and bodies. And I'd just like you to comment on that because it's becoming repeated so often in New Zealand that people are starting to believe it.
Thank you very much. I'd love the New Zealand Psychological Society to get in touch with the British Psychological Society, because their cough has been softened in the last week, and they released a letter yesterday, the British Psychological Society, saying that a sobering moment of reflection has happened in psychology as a result of the independent review that came out last week, and that realized that this gender affirmative approach is unsafe and it's not viable for children. And, you know, this question goes to the very heart of what has happened. And what has happened is activists are now telling doctors how to perceive a condition. And the activists are the tail is wagging the dog, and the activists are shaping the treatment paths. And I have never seen this happen before. And it's the clash. When you start studying it, you realize it's the clash of lived experience versus expertise. And so the doctors are being dismissed, they're just experts. And the years and years they've worked, all the studying, all the analysis, that's all dismissed. And the lived experience is king. And if I have lived experience of something, well, then I have full, what's the word, authority. And it is wrong. And I think we need to kind of constantly, gently remind people that there is a diagnosis. It's called gender dysphoria, and you can't have all things. You can't have a diagnosis as well as say that this is a perfectly undistressing. This is a perfectly happy condition. Never mind whether you agree with the fact that there's a gender identity within you or not. The fact is, medical transition carries a very heavy heavy medical burden on the body. And so we have to kind of acknowledge that, if nothing else. I feel the pain of that question because it's so inutterably frustrating. But I do think for people who are feeling deflated, and I know how deflating it can be, I really feel the tide is turning. The countries are changing. Sweden, you know, was the gold standard. They've pulled back. Finland have pulled back. France have pulled back. The UK have pulled back. There is a serious groundswell of people saying, hold on. And so, yeah, okay, New Zealand Psychological Society are saying this. The British Psychological Society were saying that until yesterday. And then yesterday they said, maybe we need to think about this. I'm not saying that they've completely come over. They haven't. But they certainly, the letter that they published yesterday gave everybody pause for thought and certainly suggested there are more than one way to look at anything. Anybody who has a narrow and restrictive one-size-fits-all approach to anything is probably being a little bit simplistic. And I think the holistic view of the complex person is probably the most helpful approach we can take. And have courage and find friends that speak to reality, because it'll keep you sane. A
question from Anne. Can you say a little more about gender exploratory therapy?
Yeah. Thank you very much for asking that. Yeah, I'm a member of Cata, the Gender Exploratory Therapy Association, and we have therapists from all over the world, and any therapists who are listening are very welcome to join Cata, genderexploratory.com. And the idea is that it's kind of a new approach, that we're aware the watchful waiting doesn't really madly work in a context where there's a huge amount of online contagion. And so instead we talk about gender exploratory, where you just explore the person's kind of concept of gender, you explore the person's kind of relationship with their body. You might have, it's a very compassionate, it's a very gentle approach to therapy, very much based upon conventional therapeutic practices that have been used for decades, where you just build self-awareness. And when you build self-awareness, the individual is more empowered to make choices that are more likely to be positive. And that's it. There isn't an outcome, there isn't a planned outcome, there isn't an objective. It's just build some self-awareness around what's going on in their mind. And that's generally enough for a person. That's enough for a person to make a good and sensible and reasonable decision about their own lives. And it gives a lot of respect to the individual, and it doesn't presume that they should be kind of fast-tracked into an early medicalization of their body. Instead, it gives kind of respect to the complexity of the human condition.
Kia ora, Stella, and thank you for your kōrero. I'm Rex, and I just will keep it quick, as I feel it's a terrible minefield for parents, and there's no right answer. But your cruel optimism you talked of, the social transition seems like cruel optimism of allowing them too far along that path, as you talked just to the last speaker of that, allowing them to explore it. Get your hair cut or wear the makeup, wear the dress, these things, but full social transition, I would be wary, just that would put them on the path of they accept this. And like I say, there's no one answer or anything, and you've got to do what works for your whānau and family. But I would welcome what you said of the exploring it rather than putting it in concrete of you are socially transitioned, because you give them that label now. Yeah, just the dangers of that and the minefield all you therapists find yourselves in too. But I think it just seems a bit too much that to not allow, but social transition seems like cruel optimism to me.
Yeah, I agree. And yet I'm watching it unfold in Ireland. In Ireland, there's no major medicalisation of children. And I'm seeing an awful lot of social transition I've got teenagers in my own teenagers, mates and stuff like that. And I'm looking at it, and there's no feeling of medicalization. And so it's a new kind of phenomenon. I think it is complicated. I'm not sure where I land with it. I certainly think changing the pronouns is asking a lot from the world. And I think it makes me feel very uncomfortable. I think the gorgeousness of being a teenager is finding tribes and getting really into it and really going for your gender expression, or just your physical expression, and the extraordinary ways that you can, like when I think of different ways of people express themselves between 12 and 25, it's really quite extreme. And so these days, this is the way they are choosing. It's gone into a very gendered expression. I have the same concerns as yourself, and I'm reluctant to land anywhere. It's evolving. So yeah, I agree, but I'm very unsure about where we're going with this.